Is your baby struggling with reflux, spitting up, or discomfort during feeds or after feeds? What if I told you that a tongue tie could be the hidden cause behind these issues? In this video, I'll help you connect the dots between tongue tie and reflux, and most importantly, share practical steps to support your baby. Hi, I'm Kylie Etz, a pediatric occupational therapist and infant craniosacral therapist. I'm also a holistic sleep and reflux specialist. I work with mamas and their little ones to overcome feeding, sleep, and developmental challenges. Reflux is one of those issues that's often misunderstood, and today I'm going to break down the connection between reflux and tongue ties. Have you ever wondered if your baby's reflux could be more than just normal spit up? Let me know in the comments below, and hit subscribe for more holistic baby wellness tips. Before we dive in, make sure to download my free tongue tie symptoms checklist. It's an easy to use resource that helps you track symptoms and to help you figure out what might be going on with your baby and whether it could be a tongue tie. The link is in the description below. Let's start with how a tongue tie can contribute to reflux. A tongue tie happens when the tissue connecting the tongue to the floor of the mouth is too tight or thick or too far forward, and it's restricting the tongue's movement. If your baby is struggling to latch properly due to a tongue tie, they might swallow excess air while feeding, which leads to increased stomach pressure. And when that pressure builds up, it needs to go somewhere, either up as spit up or down as poop explosions. Now, it's important to know that spitting up is sometimes a normal part of being a baby. Most infants have what is known as physiological reflux, where small amounts of milk or formula come back up into the esophagus without causing pain or distress. But when reflux is frequent, forceful, or painful, it could indicate that something more is going on. And this is then known as gastroesophageal reflux disease or disorder, or GERD. Reflux should always be seen as a symptom, not a diagnosis. This means it's crucial to look for what could be causing the reflux, whether it's swallowing air from a tongue tie, maybe it's food allergies or intolerances, or something else entirely. How do you know if your baby's reflux could be related to a tongue tie? Here are some signs to look out for. Frequent spit up or vomiting. Babies with tongue ties may spit up or vomit more often, especially if they're struggling to create a proper latch while feeding. Gulping or clicking sounds during feeds. A tongue tie can make it really difficult for your baby to maintain a good seal while feeding, leading to gulping or clicking sounds and swallowing air. Does your baby arch their back, or cry, or even refuse feeds? These could all be signs of reflux, and potentially a tongue tie could be affecting your baby's feeding comfort and therefore increasing air intake. Let's talk briefly about the science behind reflux. Unlike adults, newborns have low levels of stomach acid in their bellies that gradually increase as they grow, reaching adult levels around like 2 to 4 months. So reflux in really little babies isn't necessarily about too much stomach acid, but rather about milk and air mixing in their stomach and moving back up to the esophagus or down through the poop explosions. When your baby feeds, their tongue plays a key role in creating a suction and vacuum seal around the breast or bottle nipple, along with triggering a peristaltic movements, which is just like wave-like movements that help food travel through the digestive system. A tongue tie can restrict these movements, leading to issues like swallowing air, poor digestion, and yes, reflux. The lower esophageal sphincter, or LES, is the valve between the esophagus and the stomach. In babies, it's still developing, so a poor latch or tongue tie can lead to reflux-like symptoms due to that increased air intake and then a valve that is not necessarily closing strongly. So if you suspect a tongue tie might be causing your baby's reflux, what's the next step? It's important to seek out a functional assessment by a trained professional, such as a lactation consultant, or a pediatric occupational therapist, or speech language pathologist, or a pediatric dentist, or even a pediatrician, but you really want to make sure that they have additional training in tongue ties. Can it elevate? Can it extend? Can it cup around the nipple? Can it do that wave-like motion that is sucking? Can it move side to side? Can the middle portion and the back portion of the tongue move? These movements are critical for effective feeding and reducing reflux that might be because of increased air intake. While you're navigating your baby's reflux symptoms, here are some things that you can do to support them at home. If you are breastfeeding, try either feeding your baby in an upright position. Try either feeding your baby in an upright position or using the laid back feeding position so that they are belly to belly with you, but on a bit of an upright angle. If you are bottle feeding, I find that actually a slightly elevated side lying position can work so much better than that classic cradle position when it comes to supporting tongue function and reducing air intake. Also, holding your baby upright for at least 15 to 20 minutes after each feed can really help to keep that milk down, and try to make sure that they're not being bounced or swung too much right after eating. So snuggle with your baby in a laid back position, wear them in a carrier, or just carry them around the house. Simple oral exercises and suck training can also help improve your baby's tongue function. So for example, offer your baby a clean finger or a pacifier for them to practice sucking and strengthen their tongue muscles. Ideally, you build time in for this before a feed so that their tongue gets a little bit of a warm-up and practice before the feed itself, which often helps their tongue function and reduces air intake. Make sure your baby is in a calm, quiet environment during feeds to really reduce any stress. If you're noticing signs of food allergies or intolerances, then consider consulting with a healthcare professional like a naturopath or someone for dietary guidance. If you found this video helpful, please give it a thumbs up, leave a comment, and don't forget to subscribe for more baby wellness tips. And remember to download my free tongue tie symptoms checklist below this video. It's a great resource to help track your baby's symptoms and to get a better idea of what might be causing their feeding difficulties, their discomfort, and their reflux.